All right, we're here to talk about the veins in your legs. And the reason you're watching this is because you've been diagnosed with having what they call venous reflux, or also called venous insufficiency or venous incompetence. Venous meaning veins. Just to remind you again, there's two types of blood vessels that we're concerned about here. There are the veins and the arteries. Arteries carry blood away from the heart. Veins carry blood back to the heart. And again, veins carry blood back to the heart. So, in your legs, you've been diagnosed with incompetent or reflux. And what is that? In your veins, that's typically the veins that are close to your skin. If this is your skin here, the great saphenous vein, these valves, what they're supposed to be doing is that they allow the blood to go back up towards the heart. But if you have incompetence or reflux, they don't shut. What happens is when your heart rests and in between the heartbeats, blood will fall back down the vein, and blood is trying to come up the vein as well. And what happens is blood will seep out, head towards the skin, and you get your varicose veins, your spider veins, your discoloration. Your leg will get swollen, achy, throbby, and heavy, especially throughout as the day goes. Your leg gets more and more symptomatic, and hence what through ultrasound we diagnose the fact that you have venous insufficiency. In addition to that, you also need to undergo what they call a intravascular ultrasound. And what is that for? Is to also identify iliac vein compression. And what is iliac vein compression? So again, just to remind you, veins carry blood back to the heart, arteries away from the heart. The artery, which is the red, the big aorta, as it comes down around the level of your belly button on your back, it splits right and left. But the artery sits on top of the vein. And it is very possible where the veins, as they're trying to bring blood back up, they have to go underneath the red. And what happens is, instead of being fully dilated like this, the artery pushes on the vein and compresses the vein, hence called iliac vein compression. And that's diagnosed using intravascular. What intravascular means is that the ultrasound, unlike the one you had for your reflux studies where it's just gel, we actually put an ultrasound inside the vein and look and identify the compression. If we find the compression, at the same time, we can actually fix this so that I can get your vein back dilated. And typically, how do I do that? Is usually with a stent, all right? For the ablation or for the reflux, how do we repair that? Well, we use heat or sometimes glue. Glue is pretty simple. If you are of the right candidate for the glue, we will enter the vein down below simply with an IV. The IV catheter will then extend all the way up to the groin or to the level of the reflux, and all we do is inject the glue. All you feel is us numbing up the skin at the entry site. Very simple. If you're not a candidate for the glue and we have to use heat, which is ablations, well then we put the wire all the way up to the junction under ultrasound to make sure that we're not at the junction. Why? Because we don't want the heat probe close to the deep vein so that you don't get a clot in the deep vein. Once we have the heat probe in position, we will numb up the skin along the entire length. We numb up all this skin with numbing medication and saline to prevent your skin from being burned and so that you don't feel the heat. Once we have numbed up your entire area that's to be treated, we'll then just turn on the heat probe and pull it out. Giving you the numbing medication along your skin takes the longest. That's about 15 minutes. The heat probe is 4 minutes. But once you're done, what you can experience afterwards is that you need to know that you might get a vein that we treated with heat that's going to turn red and very sore for a couple weeks. Simple. All you do is wear your compression stockings, Advil, and some heating pads to that. The only other things that we need to be aware of, I already mentioned, is that the heat probe we don't want to extend to the deep vein. Does that mean if we keep it away from the deep vein you won't get a clot? No, but the risks are very low. So that's why that after you have the ablation, it's very important that 3 days later, 2 to 3 days later, you are scheduled for an ultrasound to see if you have any clot form right here at the junction. If clot goes up to the deep vein, you're okay. But if any clot exceeds and goes into the deep vein, then you may be put on a blood thinner for approximately 3 months. In addition to that, you make sure that you wear your stockings afterwards for the ablation or glue, and you keep walking. There is no downtime after this. Again, after your ablation, you are not to lay still, you're not to lay in bed, not to put your legs up, because that will cause clotting. Wear the stockings, walk around, go shopping, go out and walk around to prevent the clot. In regards to the last thing for the IVUS, for the most part, it's an IV that we do insert in your vein at the base of your neck. And I know this sounds horrible when you hear the neck, but it's just put an IV at the base, in the vein at the base of your neck. And through that IV, we can treat all this. When you're done, the only thing that you might experience from putting a stent in there is you might feel pressure in your back. If you feel pressure or pain, Advil for the inflammatory and pain component will help you with those symptoms. At worst, some people might need some steroids like prednisone for a couple days to help with the inflammation. But other than that, Advil and a back warming pad should be enough to help you with the symptoms associated with a stent placed in your iliac vein. For the most part, people after this procedure get up and walk away right away, because all we have to do is remove that IV from your vein, and there is no incisions, there's hardly any ever bleeding issues, and people do very well from that.